You know, this post-breast cancer needs everyone to care. This global illness needs everyone to care. Now wherever you go, you go. Yes, we know we must win. We will fight this thing called cancer. We are champions. We are black people. We are gay. We will win. Yes, we know we must win. We will fight this thing called cancer. We are champions. We are black people. We are gay. We will win. If we fight, we won't lose. We won't fail if we faith love. We will overcome. Prostate cancer wherever. No matter what we do, we know we fail at all. We know no move forward. We know they give up for less. Because I care, you care. Yes, we know we must win. We will fight this thing called cancer. We are champions. We are black people. We are gay. We will win. Yes, we know.
Hello, everyone, and happy Friday. My name is Jeffrey. I am your Senior Program Coordinator with iCCaRE Consortium. And happy Friday. Welcome to the iCCaRE Educational Webinar. Today we have two great presentations from some members of iCCaRE in Africa. So let's go ahead and get started. So one of our first presenters is going to be Paul Badejo. Paul is a clinical research coordinator whose role is to manage and oversee clinical trials, ensuring that studies are conducted ethically, safely, and in compliance with regulations, with key responsibilities of study preparation and planning, participant recruitment and management, data collection and documentation, compliance and quality control, and coordination and communication with study teams. Having gathered experience in clinical diagnostics radiology for about 16 years, the practical skills and educational knowledge he has acquired over the years has helped him with his role as a clinical research coordinator for CAP-TC and the various studies he coordinates, including the Ironman study and vitamin D study that focuses on prostate cancer. And with that, we're going to play Mr. Paul's presentation.
Good morning, good afternoon, good evening, everyone, from wherever you're watching me live now. My name is Badejo Paul, and I'm reaching out to everyone from the ancient city of Ibadan in Nigeria. I'm the clinical research coordinator for CAP-TC in Africa. I'm really excited to be here this morning to share my experience with you in the vitamin D clinical trials that is ongoing at the University of Ilorin Teaching Hospital in Nigeria. And I want to use this opportunity to say thank you to Professor Adedoyin for counting me and making me to be part of the team. It's really a wonderful learning experience for me. It's been a wonderful learning experience. It's been a very tremendous experience for me to meet with a lot of people, the doctors, the pharmacists, both the global team in Nigeria and the US working together to make this study a success. And I really appreciate everyone. I say thank you for your contributions. Thank you for all that you have done. Thank you, Ma, because I have had to learn, to relearn and unlearn some things, and it has actually helped me a lot. And now we're going to look at what we have achieved in the vitamin D study. And Jeffrey, thank you for the introduction. Thank you so much. Thank you so much for the introduction. Say thank you to everyone. And I want to use this opportunity to share my slides with you so that we can all see what we're doing, and we'll not be talking about the vitamin D trial itself. I'm not going to the nitty-gritty of the vitamin D trial itself, but I'm talking about the process with which we used in getting to where we are now in the study. The study is at a phase where recruitment is going to start. The study is at a phase where recruitment is going to start, and we are eager to start. And once again, my name is Badejo Paul, and I'm a clinical anatomist by profession, and I'm also the clinical research coordinator for CAPTC in Africa. So we'll be looking at the clinical vitamin D clinical trials using the following outline. We'll look at the background of the study. I believe everyone can see my slide. We'll look at the background of the study, look at the objective of the study, the accomplishments we've had in the study, the challenges that we encountered, the difficulties that we encountered, and how we overcame those challenges. And I will also be giving my own suggested solutions and recommendations to further studies that we may have. Now, looking at the background of the study, we have to look at the background of the study from different perspectives. We look at vitamin D insufficiency and diseases, and it will be of worthy to note that vitamin D levels that are lower than 30 nanogram in individuals are linked to a higher risk of cardiovascular disease, to cancer, and to infections. It goes a long way to show us how important vitamin D is in the body. And because I'm reaching to you live from Nigeria, and because we're in West Africa, this study is looking at cancer patients in West Africa, Black cancer patients in West Africa, and we're looking at Black individuals. We looked at the topic under the vitamin D insufficiency in Black subjects, and we found out that based on the study that have been done previously, individuals with higher melanin levels are more prone to vitamin D insufficiency because of the presence of melanin on the skin, and it reduces the ability of the skin to produce vitamin D from sunlight. So that's why we are looking at this study in Black subjects. We are also looking at the background of the study in the area of vitamin D insufficiency and cancer mortality. And it may shock some people to know that vitamin D has actually contributed to reduce risk of cancer mortality by 16%. It shows how important vitamin D is. So the levels of vitamin D in the body is very, very important. And we also looked at the background of study from the vitamin D insufficiency and immunological functions. The insufficiency of vitamin D is associated with increased risk of autoimmune disease and infection. It means when there are low levels of vitamin D, the subject or the person is at an increased risk of autoimmune disease and infection. And all these things have been supported with data. There are data supporting this proposed study. The data shows that preliminary studies show that high prevalence of vitamin D insufficiency in Black population. There are studies that have shown that there is an increased level of vitamin D insufficiency in the Black population. That's why we are carrying out this study in West Africa and Nigeria, And kudos to Professor Popola for this study, for bringing this up. And we're happy to work with the US team. I want to say thank you to Dr. Otero, who is concurrently doing this study also in US. And thank you for the US team, who is also carrying out this study along with him. So there are various objectives that we'll be looking at in the study. The objectives of this study is to evaluate the prevalence of vitamin D insufficiency among Black West African prostate cancer patients. We'll be looking at it. How does vitamin D, how does it affect prostate cancer patients in West Africa? We're also looking at to determine the deficit in immunity associated with vitamin D. What are the deficits that are in the immunity level that are associated with vitamin D insufficiency? Because just like I said earlier, the presence of melanin on the skin is a contributing factor to the deficit of vitamin D in Blacks. And we're also going to evaluate whether the peripheral blood immune cell function is different in the Black African American in US compared to the Black West African prostate cancer in Nigeria. Like I said, this study is going on concurrently, both in the US and in Nigeria. And this study will help to improve the quality of life of the cancer patients. Also, one of the objectives is we'll be performing a retrospective comparison, like I said, with the data from Mayo Clinic that is being done presently. We're going to compare the study together and be sure that to know what is the next line of action to take. And in this comparison, we'll be looking at the metastatic or locally recurrent disease in patients as compared with those with localized disease, those that have the disease that have the prostate cancer disease, metastatic prostate cancer disease, and those with localized prostate cancer disease. We'll be looking at all these things, compared it together, and the result will be published later to the public, made public, and this study will, I believe, will be beneficial to all prostate cancer patients wherever they are. It goes a long way to show us how important vitamin D is. And we'll also be looking at assessing whether vitamin D replacement is associated with the improvement of the patient's quality life, the quality of life of the patient. We want to see that if vitamin D are administered to this patient, will it improve the quality of their life? Will it affect their PSA progression in the participants of this study? However, like I said, we're not going to look at the nitty-gritty of the study itself. I'm here to just tell us the process of the registration for the clinical trials, and the process we undertook took some time, and we are at the topmost level now. And we'll be looking at that process based on the requirements that are required for the process. And I want to say that it was a rigorous process, getting all these requirements together, putting everything together, and we are ready at the stage of recruitment. And I want to use this opportunity to thank Professor Popola once again and Professor Rotimi for their relentless efforts to get this study on the way. The global team, I want to say thank you to Dr. Otero. I want to say thank you to Dr. Bonner, Dr. Babel, and Sandra. I want to say thank you to you too for your contributions. And Dr. Ojo, thank you also for your contributions for the success of this study. And especially now that we are at a very critical stage, we're going to have the virtual site visit by the DOD in September, and its preparations are in top tier for this study. Now, the requirements that are required for the start of this study for the vitamin D clinical trials includes writing a protocol and getting it approved by the ethical committees in the University of Ilorin Teaching Hospital. They approved the IRB. And we also had to register with NAFDAC, because that's the regulatory body for every clinical trials that will be going on in any part of the country. We needed to register with them, needed to register the trial with NAFDAC, and then it was a challenging time. There were a lot of requirements, document upon documents, and a lot of documentation that we need to submit. And I want to use this opportunity to also thank Savante. They are the CRO that helped us with the registration with NAFDAC. And we also have to choose the vitamin D that will be used. And that vitamin D has to be the one that's been approved by NAFDAC for use in Nigeria. And we had to get one, and we had to send it to NAFDAC. Even the IRB approval, we have to send it to NAFDAC. The letter we use in applying for the IRB approval, we have to send it to NAFDAC. They need all this documentation for the registration of the trial. And we also had to choose the Nature's Field vitamin D, because it is approved and it is registered by NAFDAC in Nigeria. And also the insurance for the participants. We have to make sure that there is an insurance for the participants for this study, and it's also one of the requirements of NAFDAC for this study. We also needed to get a material transfer agreement with Mayo, because by the time we start the study with collection of samples, the samples will be collected and tests will be run on those samples, and be stored in -83-degree freezer at the University of Ilorin Teaching Hospital. And these samples will have to be sent to US. And there must be a material transfer agreement between the University of Ilorin Teaching Hospital, the study team here, and Mayo Clinic, where we are sending the samples to. And this is also required by NAFDAC. NAFDAC needed to see the material transfer agreement, and it was signed and sent to NAFDAC. We also needed to set up the laboratory where the study would take place at the University of Ilorin. And I can tell you for sure now that the lab is 95% ready, 95% ready to begin the study. The equipments are there, the samples, reagents to be used for the samples are available, the manpower is available. We have a team of doctors, pharmacists, laboratory scientists, and technicians. A clinical research coordinator is also there with them. Secretaries, people will be registering the patients, and everything is ready there. And also, for this study, there's need to also have the informed consent form, the informed consent before recruiting the patient. And also this had to be approved by the ethical committee and also sent to NAFDAC. The informed consent form was drafted, approved by the ethics committee in the University of Ilorin Teaching Hospital, and also it was sent to NAFDAC for approval. We also had the need to have the research instruments prepared, and kudos to the MAMSCO team. Thank you, Dr. Adedoyin, for your great effort in reviewing the instrument for the study. And the instrument for the study was also sent to the ethical committee, and it was approved. And NAFDAC also approved it, and we are glad that we are where we are now. We also needed to constitute a data safety monitoring board, which are members of the university community, members of the community at large, and members of the study team to be part of the data safety monitoring board. Our assignment is to continue regularly to check on how patients' data are managed and how they are being transferred. And this is a very good development, and it is also one of the requirements for the NAFDAC approval. And I also want to say thank you to Professor Dodino for our effort in getting the NAFDAC approval. It was really, really a tough time, intervention, and a lot of help here and there getting the approval. We are glad that where we are. And thank you, Professor Pupola, for getting the clinicaltrial.gov registered. for the University of Ilorin Teaching Hospital. We want to say thank you. This trial is ready to go. And like I said, we are at 95% ready for this trial. Now, I'm really, really elated and glad to share all our accomplishments that we have done for these clinical trials. We have the IRB that have been approved. We had the informed consent form to be administered on the participants, also approved both by NAFDAC and the Ethics Committee. We have the FWA renewal for the University of Ilorin Teaching Hospital, also approved, with the material transfer agreement between the University of Ilorin Teaching Hospital and Mayo Clinic approved for this study. And also, we also have the NAFDAC approval for the study. The NAFDAC approval for the study, we have it, and all the requirements by NAFDAC was met, and the approval was given, and therefore the study can commence. And I can tell you for sure, we are in communication with NAFDAC every time, both myself and the CRO, that's Savante. We've been in communication to let them know where we are on the study and how the process is going and where we are. And then they are glad that we are always giving them update on where the study is. Also, I want to, like I said earlier, thanks to the MAMSCOR for helping us to review the research instrument that was developed and will be administered to the participants. And we already have a study team in the University of Ilorin Teaching Hospital ready to take up to start the clinical trials. It's a team of, team of doctors, residents, scientists, laboratory scientists, pharmacists, clinical research coordinator, secretaries, people who will be working tirelessly to make sure that this study is underway and it's properly done. And I'm happy to tell you that this team has been properly trained, because a lab manual was developed. And they were trained in January, and there is continuous training for them to be brought up to speed concerning what is required for the study. And this training is on regular basis, and I believe that immediately the participants are recruited and they will start a sample collection and administration of the vitamin D. I'm glad to tell you that everyone is ready. We are ready. And I want to say, are you ready? You too should be ready so that you get involved. Thank you so much. And I want to say, everyone that is in the study also had to go through good clinical practice certification. You have to go through this training, both the PI and everyone in the study, because their certification is also required by NAFDAC. We needed to submit everybody's certification to NAFDAC because they are part of the team. And NAFDAC will need to see that everybody has undergone and are certified for good clinical practice. And that is where we are now. And I'm really excited to tell you that we are super, super ready. And thank you to all the global team for their relentless effort on getting all these things done. It is not a day's job. It is not a single man's job. It is a collective effort. And the credit goes to everybody, to everyone involved in the study. And I want to say thank you so much for all your effort. And there are challenges which we encountered. We had challenges. We had difficulties, but we overcame them all. There are challenges, and one of the biggest challenges we had was NAFDAC registration. We had a very big challenge with the registration, request for documents, this and that, payment, and the rest. And we say we're able to overcome this, even with the difficulty and the bottleneck at NAFDAC. We're able to overcome this, and we say thank you to Professor Adedoyin for our intervention and advice and our guidance on what is needed to do for the NAFDAC registration. And we say thank you also to Savante for helping us with the registration. Thank you to, we also had difficulty in constituting the study team, but now we have a study team comprising of scientists, pharmacists, doctors, resident doctors as well, medical laboratories, scientists and technicians, the clinical research coordinator there in Ilorin, and all the secretaries that will be working with them. The study team is ready to take up this task, and it was a bit of challenge getting them, putting everybody together. But at the end, we got the team ready, and they have undergone training with the study manual, and there's constant training, like I said earlier, there's constant training with them for the study, and they have actually been reviewing and getting ready for this study. And like I said, we are at a point where recruitment will begin any moment from now. We have a virtual site visit coming up in September, and we are gearing up for that virtual site visit by the DoD. And everybody hand is on deck to make sure that things are done. And like I said, we are 95% ready for this test, for this study. Also, one of the challenges we also had was the late submission of the good clinical practice certification by the study team. Some of them don't have their good clinical practice certification. We had to make everybody get their certification ready. Those who had and that expired, we had to make sure that they get it renewed. Even myself, I had to get my own and submit it to NAFDAC, and before we could get the approval from NAFDAC to begin the study. And also, we had difficulty in getting consumables, materials, equipment for the study, but now we are set. The consumables are ready, the materials needed, the data requirements, entry requirements are ready, and everything is ready. The manpower is ready, and we are good to go. And like I said, are you ready? We are ready at the University of Ilorin Teaching Hospital to get this thing done. And how ready are you? And these challenges came with a lot of issues, but we're able to overcome them all. And kudos to everyone. Kudos. It is not a single man's job. It's kudos to everyone. Kudos to the US team, Dr. Babel, Dr. Otero, Dr. Bona, and Sandra for your relentless effort, and everybody that I can't remember their names. Thank you so much. And thank you to the Nigerian team, Professor Popola, Professor Rotimi, and Dr. Aziz, and then Dr. Joe. Thank you, everybody, for your, and Dr. Sholak Bade, thank you, everybody, for all that you are doing. And thank you to the newest addition, Mr. Rokoyo, the clinical research coordinator that will be working with Professor Popola at the University of Ilorin Teaching Hospital. I want to say thank you to everybody for your contributions. And I say that I believe that at the end of this study, solutions will have solutions, we'll have recommendations, we'll have improvement in the quality of life for prostate cancer patients, especially the black men, the black prostate cancer patients that we have, especially in Nigeria and West Africa. And I believe this study is going to be really, really beneficial. And we look forward to the commencement of this study very soon. There are a lot of patients that have indicated interest to participate in this study, and everyone is cheering and getting ready for this study. And I say kudos to everyone. I say thank you to everyone. I want to give my own suggestion and recommendations on subsequent trials so that we can have easy and smooth registration for the trial. One of the things that I suggested is to have early documentation and registration with NAFDAC, because registration with NAFDAC take about 60 working days. And one of the things that I've done is to undergo a training with NAFDAC on documentation and registration of clinical trials, which will be coming to an end this month. It's a 3 month training, and it's an intensive training, and I've been undergoing that training for some time, and to coming to an end this month. And this will enable me further clinical trials to fully participate and help with the NAFDAC registration to make it a very smooth running, so that we don't go back and forth and waste time on any study. Also, I will also recommend that everyone in the study, if you are good clinical practice is expired, you get it renewed. Get it renewed every time. I think it's about 2 to 3 years certification. When you look at the certification, when you do it and you see that it's going to get expired, get ready soon and get another certification as quickly as possible, because you don't know when you will be called upon to be part of any clinical trials. It's always very important that you get your certification ready at every point in time. And also, I recommend continuous training for all the lab personnel to ensure that we go through the lab manual regularly, so that we can have a complete compliance with what we have in the protocol. If there are going to be any changes, we need to inform the ethics committee and also inform NAFDAC to let them know there are changes in the protocol. So if we're going to have this study done properly, there should be continuous training for members of the study team on the lab manual to ensure compliance to the study protocol. And I want to give my submission that this study has come to stay, and definitely it's going to be really, really wonderful to have results from this study and to improve the quality of life of prostate cancer patients, especially the Black men in West Africa, and especially, to be specific, in Nigeria. I know this study will be beneficial to everyone, and the result will be made public at the end of the day, so that prostate cancer patients that are Black everywhere in the world can have a good quality life. And I'll say thank you to the team. Thank you, Professor Dedino, for this wonderful opportunity. I do not take it for granted. Thank you, Professor Popola, Professor Rotimi. I say thank you. Thank you to the entire study team for your wonderful contributions and your encouragement. There were errors that were made at the beginning, and I've learned how to relearn and unlearn some things. And it's been a wonderful time working with the whole team. And I say a very big thank you to everyone. So we'll move to the question and answer session. If you have your questions, if you have questions, comment, please do well to leave them in the comment section, so that can be attended to. Thank you so much. And I say a wonderful afternoon again to everybody. Thank you for staying put on this study. And I look forward to having you again when I come your way again for a review on where we are concerning the study. Thank you, everyone, and good afternoon. Jeffrey, I say thank you too. And thank you for the opening remark. Thank you. And over to you. I will stop sharing now. And thank you so much. Jeffrey.
All right. For our audience, please storm in the comments with some questions for Mr. Paul. Mr. Paul has joined us to answer any questions. I know you said you might have some weather causing some issues. Can you hear us, Mr. Paul? I know we may be having some weather issues with connection, so we may save questions, and then Mr. Paul may be able to come back on and answer them at the end. But please ask any questions. And thank you again for sharing about the vitamin D study. That's some good work that you guys are doing for iCCaRE in Nigeria. Alrighty, so it doesn't look like there's any questions, so we will move on to our next presentation. So our next presenter is going to be Ms. Adedoyin Williams. Ms. Williams is an experienced research and outreach coordinator with expertise in managing behavioral studies, supervising large scale data collection, and leading impactful community outreach programs across Africa. She is dedicated to fostering collaboration and driving initiatives that create lasting positive change in communities.
Hello, everyone, and happy Friday to us all. My name is Williams Adedoyin Elizabeth, and I am the research coordinator for the African Behavioral Research Center here in Abeokuta, Ogun State, Nigeria. Today, I'm going to be talking to us about the ABBA Center, our mission and our vision, services that we offer, and some of the achievements that we've had from our projects and our impact in the community through our outreaches. The ABBA Center is an arm of the Prostate Cancer Transatlantic Consortium, that's CAPTC. ABBA Center was set up in the year 2019, and we are focused on reducing the burden of chronic non-communicable diseases in Africa through our training and education and our behavioral research. We also here at the ABBA Center partner with different organizations across the globe in order to expand our visibility and also implement our community outreaches. Also, we serve as a central repository for behavioral research, intellect, translational services, data collection services, survey methods, and qualitative research. We are located at the Federal University of Agriculture and also at the Federal Medical Center at Belkuta. Our director at the Federal University of Agriculture is Dr. Catherine Oladoyinbo, and our medical director at the Federal Medical Center at Belkuta is Dr. Chidebere Ogo. At the ABBA Center, our mission is to achieve equitable health, cancer prevention, and cancer control for all Africans through quality behavioral research. And our vision, at the ABBA Center is to be a global leader in cancer prevention and control for Africa through behavioral intervention. Some of our very key strategic areas here at the ABBA Center is the training and education, community engagement, partnership and outreach, and translational behavioral research. These areas are very key strategic areas here at the ABBA Center. At the ABBA Center, we offer different services. We offer different services. I like to start with the language translation. If you need your instrument translated to any indigenous language, all you have to do is to reach out to us. ABBA Center translates different documents, different materials, different instruments to different languages. Instruments that can be used during in your study or for outreaches. ABBA Center can translate it to different indigenous language for you. Also, we validate different instruments. I'll be talking much later and showing us one of the instruments that Ava Center validated and it's already out there and getting a lot of great reviews. We also offer our services in the area of data collection. If you need your data collected, if you want to collect data in any community, all you have to do is to reach out to us and we'll be glad to do that. Also, we have our very own biostatistician here at the ABBA Center who analyzes data. So if you need your data analyzed, if you want your data from any of the study analyzed, please reach out to us and then we get that done. And for community outreaches, ABBA Center has been known to conduct great outreaches. We've conducted different outreaches in different locations across Nigeria, across Africa. So if you have any outreach that you like Ava to help you um, conduct, just reach out to us. And also for training and education, we also offer our services in this regard as well. Just recently, Eva Center concluded the training for the coordinator that will be collecting the data for the CAPCA study. So Eva Center also does that, also is part of the services that we offer. And regarding education, we have the iCCaRE Global Oncology certificate program that Ava Center facilitates. So these are some of the services that we offer here at the Ava Center. So if you need any of our services, please reach out to us through any of our social media handles or send us an email. We'll be glad to respond to you. Moving on to some of the one of our study that we're talking about today that has brought about great achievement for us is the familiar cohort study. The familiar cohort study started around 2017-18 among a healthy cohort of men in Cameroon, in Nigeria, and the United States. Um, Apart from the manuscripts that has been published and written from this study, Ava Center decided to host a writing, a manuscript writing workshop series. And from this workshop, a community was set up. Uh, this community included people, clinicians, researchers, um, early stage career investigators who were interested in using the data collected from this study to come up with a manuscript. And from this community of clinicians, researchers, and ESIs, we have successfully come up with six manuscripts that are ready. There are more, but six of them are ready now, and they are ready to be published in an high impact journal. Uh, I'm going to be sharing with us some of the titles of these manuscripts. The first from of the manuscript is the dietary practices, nutritional status, and the risk of prostate cancer in Nigerian men. The second one is the association of meat, starch, and vegetable-based meal consumption on BMI and perceived health of West African men and West African immigrants in the United States. Another title is the lifestyle factors, anthropometry, and environmental factors as predictors of prostate cancer, a multivariate analysis between healthy controls and prostate cancer patients. Another one is the socioeconomic status and prostate cancer outcomes in Nigerian men. Also, we have another manuscript titled Comparative Study on the Knowledge of Prostate Cancer, Health Case Access, and Behavior of West African Black Men and West African Immigrants in the United States. And last but not the least is the impact of comorbidities on prostate cancer outcomes in Nigerian men, identifying the killer. These are the six manuscripts that are ready to be published in the High Impact Journal. This is one of the achievements that we've been able to come up with at the Abba Center from this study. So, like I said earlier, this is one of the achievements that we were able to get from this study. There are more manuscripts that are coming up still from this study, but these are the six that are ready now, to be published in an high impact journal. Moving on, I said earlier that I was going to talk about the instrument that Ava Center validated and is getting so much great reviews after it's been put online, and that's the Portrait House of Humor. Is a short film. Ava Center was contacted to validate this instrument before it was put out, and we did that. And after the short film was put out, the reviews from this short film has been nothing short of great. It's been really great. So, like I said earlier, Ava Center is if you need your instrument validated, Ava Center can do that for you. If you haven't seen the Portrait House of Humor, you can go to YouTube and check it out. It's a great short film. And also we have trained over 100 community health workers. I said earlier that Ava Center is also involved. One of the services that we offer is training. We have trained well over 100 community health workers, research assistants, uh, um, at the Abba Center. These are some of the pictures from the training that we held. And so, if you would want any of your research assistants trained for any project that you have at hand, or you want to, or any project that you want to do, or any study, so you can reach out to us at the Abba Center also. Moving on to the iCCaRE Global Oncology Certificate Program, that's the education aspect that we also offer our services in at the ABBA Center. So the iCCaRE Global Oncology Certificate Program, ABBA Center in partnership with iCCaRE is the one facilitating this Global Oncology Certificate Program. And the aim of this program is to facilitate the development of a cadre of well-trained early career investigators who can effectively address the issue of cancer prevention, cancer control, and survivorship. From the first cohort of this certificate program, we received a total of 31 applications, and 15 of them, after much review, were eventually selected to participate in the program. We had people apply from different nationalities all over the world, and just recently in May, we graduated our very first cohort of the Global Oncology Certificate Program. It's a 1 year program. It's a 1 year program. And during the course of the program, students were assigned to mentors to help them with their research projects. And from this research project with their mentors, we have 3 manuscripts. One is under review at the moment, and 2 are also going out for review soon. So the Global Oncology Certificate Program facilitated by EVA is a great success, and it's continuing to still be a great success. This is a picture from our graduation and the certificate that was issued to the students from the first cohort. And just recently, application was also put out, for the second cohort, and we received a total of 60 applications from different, like I said earlier, different nationalities, all over the world. And from these 60 applications, 30 of them were eventually selected, and classes have started, and classes have begun for the Global Oncology Certificate students. So I encourage us for another cohort that will come out after this. If you're interested, you can as well be a part of this Global Oncology Certificate Program. Moving on to our community outreach and nutrition RX. Our outreach program, I said I'm going to talk about the impact that we've had, from our outreaches. This nutrition RX and our prostate health awareness outreach, is aimed at educating these men on the issue of prostate health and prostate disease, and also offer them free PSA and digital rectal examination in the process, and also give nutritional support to to this um, to this men. We have had this program uh, held in Badagry. We had well over 600 or 700 men in attendance. We have had this program also in Lagos. We had this also in Ivory Coast. That's why I said we have impacted a lot of lives through our prostate health awareness and screening and nutrition RX outreach that we've held. We have had it in different locations in Cameroon, in Ivory Coast, in Maiduguri here in Nigeria, in Lagos, in Abeokuta. So it's been very impactful. We've had questions from the men even afterwards, after the training. They reached out to us, wanting to know more, wanting to speak with the medical director. Some after the PSA result came out, had to go and see the doctor, and we've had great outcomes from this program. So this is one of the ways that Ava Center is also impacting the community. We are currently also right now at another community where we are having this same outreach, with the free PSA and digital rectal examination screening, and most importantly, speak to these men on the issue of their prostate health so that they can, go for screening on time and then know what the risk factors are and all the things that they need to know regarding their prostate health. So this is one of the ways that Ava Center has been very, 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 very impactful. I want to say a very big thank you for this opportunity, and thank you for having me today on the webinar. Thank you so much.
All right, thank you, everyone. And for the audience, please put your comments in the comment section with any questions for Ms. Williams. Thank you, Ms. Williams, for presenting on the good work that the ABRE Center is doing, some good outreach initiatives going on there. So we would love to hear some questions. Please enter any questions for Mr. Paul or Ms. Williams. And then we were having some connectivity issues earlier. Mr. Paul, can you hear us?
Yes, I can hear you.
All right.
Can you hear me?
Yes, sir. All right. So we have a question for you in the chat. The question says, what do you see as the most challenging thing in working with global partners?
Yeah, thank you very much. One of the biggest challenge that we had was the global time difference. That was at the beginning of the study, there was a really big challenge with the timing of the meetings. There was a time we had one of the study team members that it was in Australia, and at time it's 5:30 a.m. in the morning. In Nigeria, we are at around 9:30 p.m. and in the US, probably maybe in the evening. It was quite a bit of a challenge setting up and getting up the right time for the meeting. But in the end, we were able to come to a common ground. We got the time that is most suitable for everybody, and we got the ball rolling. It was quite a challenge. Also, one of the other challenge that we had really was with NAFDAC. You know, there are issues that borders to registration of clinical trials in Nigeria, and you must be specific in whatever you are doing, and you have to be up and tight and get it correctly. Without that, NAFDAC will not approve the trial, because these trials involved human subjects, and they don't take it kindly at all, because we're going to administer drugs, we're going to administer a lot of things, so it has to be done with utmost scrutiny, and it has to be done properly. So the global team had to come in, they stepped in, did all they could, we did all we could too, and we overcame that challenge. So the time difference, global time difference, was the initial challenge we had. We overcame that. Then we had a challenge with NAFDAC to the registration, putting up with a lot of issues, registering the trial, submission of documents, and getting these documents from the US team was another challenge. Getting it, putting it together. Each time we submit, they'll say, okay, this other document is needed, this other one is needed, and we make sure that we did all we can, and we are where we are now. Thank you. Thank you very much.
All right. Thank you for that, Mr. Paul. Our next question is for Ms. Williams. For ABRE Center, do you see differences across different African countries on community needs?
Yes, we see different needs across different African countries. In Ivory Coast, that we went to when we went to have our community outreaches, we noticed that before then they had not even heard of a PSA or DR. They didn't even know about it, and thank God we're able to provide that for them. And also from the last place that we went in Ife, it was really, in fact, they've never heard of prostate test. They've never heard of it before. So it was one of the needs that they had there for them to be able to do the PSA for them, and then the DRE for them. And it was some of the needs that they had in their community.
All right. Thank you for that, Ms. Williams. Looks like that was our last question. If you have any more questions, please put it in the chat here. All right, not seeing any more questions. Thank you both, Mr. Paul and Ms. Williams. It's great to see some of the global work that iCCaRE is doing. And thank you for these presentations. It was some great information. All right, everyone, happy Friday. Thank you so much, and meet us next week for another streaming, same time. Have a great one.